New tonight, whooping cough cases rising significantly nationwide. We reported on small outbreaks in some local schools at the end of May. Cases have more than doubled in the state since then, and they're up nearly 5 times in Allegheny County. The county health department's acting director tells me it's concerning, and there are things you can do to protect you and your family. Whooping cough is making a comeback in Pennsylvania. Allegheny County doctors are seeing cases climbing to their highest point in nearly a decade.
We're seeing almost 10 times the cases in 2024 already compared to the past couple of years.
Take a look at the pertussis case data for the county. 226 cases in 2012 and 155 in 2014, the two notably higher years. Then case numbers kept dipping and nearly disappeared during the COVID pandemic. Now, whooping cough is back. The county is up to 87 cases for 2024, and cases have topped 1,120 statewide.
I think a lot of the cases that we're seeing now are due to some of the changes with the prevention we took during COVID, similar to other respiratory viruses.
Allegheny County Health Department Acting Director Dr. Barbara Nightingale says they're seeing the 100-day cough in children all the way up to older adults, with the average age being teenagers. The highly contagious bacterial infection reached classrooms before summer break.
A lot of the cases that we had were still occurring at the end of the school year, and also it can be contagious for a number of weeks afterward.
Pertussis is especially dangerous for babies. It's time to see a doctor when a child or adult has been in contact with someone who's been diagnosed or has symptoms.
Things that are particularly concerning is a cough that's lasting more than 2 weeks, or a cough that's so severe that the child ends up vomiting after they're coughing, their lips are turning blue, they're not able to breathe, and then sometimes you get the very classic whooping sound after coughing when you take a deep breath.
Dr. Nightingale says whooping cough can even be deadly, but it's also preventable.
It's very treatable with antibiotics, and we have vaccines that also can prevent people from getting it in the first place.